January is National Poverty in America Awareness Month, and almost 1/3 of people in poverty are younger than 18. Child poverty has decreased 59% in the last 30 years, but still about 11% of children are suffering from poverty. We're going to bring in our 9 News mental health expert, Dr. Sheryl Ziegler, to talk about this and talk about the mental and physical impact of poverty on children.
Yeah, I think, there's so much that poverty affects, but sometimes people don't think about it in terms of how you really break it down. I mean, physically, we know that they are less well. They have higher blood pressure, more cortisol, which is a stress hormone that runs through your body. Your brain actually structurally changes, and even your epigenetics gets expressed differently, your actual genetics. So there's physical outcomes, and then of course there are safety outcomes. You're more likely to be abused, live in violence, have food insecurity, housing insecurity, and so of course what comes along with that is depression, anxiety, substance use. So really tremendous overall big outcomes from poverty.
And being parents, you have to think about what this is like for a parent to go through this. It is your whole goal as a parent to protect your children at all costs. How does that, affect the relationship between parent and child?
Yeah, I'm glad you asked about it because in a really profound way. So when you're a parent and you are under this level of stress, how are you going to eat your next meal? Can you make rent? You're less likely to be attuned to your child, provide the warmth, the feedback, the attention, the supervision that they need. And so we have decades of research that says they're more likely to really lack in those kinds of areas that affect attachment because of the stress that they're under. So it's not a lack of love, but it's a lack of the ability to be calm and stress-free enough to be able to attune to a child's need.
Oh. So often you hear these stories where there are more than, multiple children in a household and one almost ends up being like a parent.
Yes.
And I think that's equally hard on them too.
It is.
Children shouldn't be parents. They shouldn't be having to do that, saying, I'll try and get you some food or I'll see what we can do.
Yeah, the other big impact is on education.
Yeah.
And that's where we see the older siblings getting them ready for school, trying to get breakfast together, figuring out lunch, walking to bus stops, trying to do homework sometimes with them. So then when you add on that layer as well, it impacts older siblings really dramatically. And it also, again, impacts kids. They're less likely to be well educated and go on, to graduate. Even graduating high school is a huge milestone when you're living in poverty, and never mind going on to even higher levels of education.
What about access to mental health care? Like, how do we get these kids attuned to their needs without help?
Yeah, and that's one of the real serious downfalls is the access to mental health care is so incredibly limited, and even high quality mental health care. And so there's a lack of trust a lot of times just in the system. They feel stigmatized. They feel like maybe they have had some experiences where people weren't culturally or socially sensitive to their needs and maybe made them feel shamed or had to call social services, right? So if you go and talk to a therapist, but then they have to call social services, there's a breakdown in trust. So it's really hard, and hopefully in the upcoming years, because this is a big report that just came out that poverty is actually going down, but we still have 11% of kids that living in poverty, still too high. But hopefully we're looking at really new and innovative ways to get the treatment that they need.
I know those are bigger picture things, but what can the rest of us do? Like, can any of us do, what can we do? I assume teachers and educators perhaps can sometimes tap into some ideas and approach it in the best possible way? Yeah,
one of the biggest things that we can do, although it's not every one of us, but really looking at pediatricians' offices, because that is one place that most parents will absolutely take their kid, right? So if the pediatricians are A, well educated in mental health, and B, do universal screenings, which actually I did see at my own pediatrician's office for the first time this year, where it's everybody gets it, you're not singled out, and you get asked questions. I had 5 questions on one sheet of paper that said, are you concerned about when your next meal will come? Like it actually just said it like that. Great. So I thought, we're making some progress.
That's amazing.
That is amazing. So more of that. And really, if we could get some mental health services right in pediatricians' offices, that would help a ton.
That makes sense. It makes perfect sense, because you're right. That's what a parent will do. Any parent will do. They'll get their child.
Right, and if you're there, right, and you say down the hall, you can go see Dr. So-and-so, it really would help a lot. So hopefully we're getting there, but we're pretty far away from it right now.
Yeah, thank you for the perspective, because you hear it's going down. It's like, yay, but so much work to be done.
Yeah.
Yep, all right.
Thank you, Dr. Ziegler.